So,
but you do know doctors that use this current day, right?
There are publications currently recommending its use, hydroxyurea. But did you mean using real urea?
Oh, yeah, I was meaning the real urea.
A few people are using it, for example, to prevent killing patients in heart surgery, but it definitely isn't a well-recognized treatment.
Now, did you say, did I understand you correctly when you said that urea, in the absence of the other electrolytes, would have a negative effect? And
it acts like distilled water as far as the osmotic property goes.
So it has to be osmotically balanced with the regular concentration of solutes that you'd normally find in blood.
It would take about 6 times as much urea as normal to not break down the red cells.
Interesting. So if you, whatever I'm not too sure what it is, but for example, just for people that are listening to understand the concept that I'm trying to describe to you and that you're describing to me, is that if you have, for example, a 1 millimolar concentration of urea in your blood normally, then if you were to inject a 5 or 6 millimolar concentration of urea into the capillary or into the artery or whatever, it wouldn't have a negative effect. It would be acceptable. But if it was injected as a 1 millimolar solution, which you'd find naturally in the blood, it would have you'd have a problem with that.
Assuming that the other things like sodium and calcium and potassium aren't compensating for the difference in urea.
Okay.
So what about taking it orally?
That's been done also for over 100 years, treating heart failure. And one person reported on, I think he said he had heart failure patients doing well on oral urea for as long as 9 years.
Wow. And this is because it's a diuretic and it's...
that was the argument that they were using it because it did relieve the swollen legs and such that occur in congestive heart failure. But I think since you also see it bringing people back from brain damage in traumatic head injury and strokes and such, it, I think, has much deeper therapeutic effects, stabilizing cells in many ways, not just reducing the swelling by causing diuresis.